Well, welcome, Dr. Barrett. Thanks for joining us today.
Thank you, I appreciate it. I'm glad to be here.
Oh, our pleasure, our pleasure. So we wanted to talk a little bit about biotemps today. Can you tell me, when did you first hear about biotemps and when did you do your first case?
So my first case was about 15, 16 years ago. I remember being in a lecture and I saw biotemps being described and how they were done, and just sold me at that moment. I knew that I needed to try to incorporate that into my practice, and since then it's just been a journey to try to incorporate that every day.
You know, it's interesting because every case needs a provisional of some kind, right? So how do you decide which cases you're going to use a biotemps provisional for and which cases you'll make something in the office?
So my criteria is that I try to use biotemps whenever I can. My thought process when I do it is I want to do it for multiple units in the anterior. I want to use it for posterior crown and bridge when I can, over implants. So for me, using a biotemp is all about having a system that yields a predictable outcome that builds doctors' confidence. So when I'm teaching doctors, the best way for me to build their confidence is to put something in their hands that will do that. And for me, that's biotemps. So I'm using it all the time in as many instances as I can.
And in your associates who you train, you teach them the same rationale?
I do. I teach them all the time. I think what most of my doctors that I train want to learn, not only the mechanics of how to fabricate, to trim a biotemp and to make all the customization for it, but also how to have a patient understand what a biotemp is. What is that verbiage that you use when you talk to patients? How do they understand what a biotemp is and what's the value in it? So I speak a lot about what my conversations are with patients. And they're very simple. If I'm doing biotemps in the anterior, my conversation is simply, you know, Mrs. Smith, it's very necessary for me when I prepare your teeth for your crowns to make you a custom temporary. I'm going to be able to make the shade, the length, all of those things that we talked about previously. I can incorporate those into your temporary. And my ultimate goal is for you to pick up a mirror and look at your temporary and tell me that you want your final crowns to be exactly this way. So when I've achieved that, then I know that this case is going to be very predictable. And I can supply to the lab photographs and study models to allow them all the information to get me the outcome that not only the patient, but that I want in this case.
So your patients, they really perceive an extra value in this?
Absolutely. So I usually will show them photographs of biotemps. I always have a model handy that I can reach over in the operatory and grab it and be able to show it to them. And there's no question that they perceive that value right away.
Right.
But it's always just part of the treatment plan. It's not you can do a biotemp if you wanted to. I could do it another way. It's always just, it's necessary as part of what we're doing.
I would imagine with your level of experience, some of the cases that you're treating, this is not the first restorative treatment they've had. So they may have had some experience with a different kind of provisional restoration. Does that help you or hurt you as you explain it?
Great question. Most of the time it helps me. You know, their experience with provisionals typically is not very good, especially when it comes to anterior crown and bridge. So when I tell them that, you know, they're going to be comfortable with their family and friends at work, whether they're going on a vacation, that I can customize the color, the size, and the shape for them, sometimes it's hard for them to believe. Right. And I pull out my photo album and I show them 5 or 6 cases. And they goes, wow, those are their temporaries. I'm okay, that's wow. Good. So, you know, the bad things that have happened to them in the past now kind of work in my favor. And I probably generate more referrals on temporaries than anything else in my practice.
That's, you know, I've always suspected that when a patient has some complications with their temporary restoration, that they may tend to lose confidence in what this final restoration will be like. Is that in your experience?
That's 100% accurate. You know, I always learned, and through my years in dental school, my professors would always say, you know, don't make your temporaries too good, right? You've heard that before?
Oh, yeah.
And, you know, if they're too good, the patients won't come back. And I always say that if the temporaries aren't good, the patients will definitely not come back. Because once they've had a bad experience and the temporary's fallen out, broken, and they've had that, they always say, well, what's my final one going to be like? Hey, doc, this temporary's not very good. When are you going to get me something that works?
Right.
And I don't want to go through those hassles. I work a lot with very young doctors, first, second, third year in practice. So I want to be able to give them a tool that helps them build confidence in what they're doing. And that's all that biotech, that's what they do for me. They help me to get to that point. So really, patient satisfaction, reduce chair time, right? So your patients aren't in the chair while you're whittling away trying to carve a temporary. That's very important. And I can take doctors, and not only doctors, but staff that are very young, and I can teach them how to reline and fabricate and get that customized temporary in someone's mouth really in a very short period of time. So I can take an average dental assistant and I can make them great. And they really enjoy their job now. They feel like they're delivering something to the patient that the patient's just ecstatic about.
Right, right. And building confidence in the practice at the same time.
Great. I mean, that's exactly what happens. You know, I'm fortunate in that I get to do all these anterior cases all the time as I travel around to our offices. And I work with really over 50 to 55 doctors every year. And I visit at least 50 of our dental practices and work with our doctors. So every week I get somebody who holds up a mirror and they look at their temporaries and they cry. And that's an awful rewarding experience for me, to know that, one, that we could do that for the patient and provide that service. So that kind of feedback is unbelievable. Very, 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 very rewarding for me.
That's great. Dr. Barrett, you've mentioned that you use biotemps to kind of test drive the anterior aesthetics. Can you tell me how that works?
So when I first see a patient and I do an aesthetic evaluation, kind of my clinical protocol that I try to do all the time is to do some type of chairside mock-up with the patient. And I use composite. It's a very simple procedure. And that gives me some direction about what I can accomplish with this patient and what the patient ultimately wants.
And is that freehand, or you use a matrix to do that?
It's freehand.
Okay.
I usually use composite. And all of my patients, I do that at no charge. And that really doesn't take me more than 5 or 10 minutes to do chairside. So it allows me to get some information from the patient. What would they like? And what can I actually do with these teeth without having to involve orthodontics or something else? And from that, I can go ahead and order a biotemp. So I take a photograph or a study model, however I get that information to the lab. So the beauty is I talk to the patients and I let them know that all of these changes that we just talked about, everything that we did in your aesthetic mock-up, I'm going to incorporate into your temporary for you. And I'm going to make sure that when you look at that temporary is exactly what you're looking for and what I'm looking for. And sometimes that's not the same, right? Mm-hmm. As a dentist, what I'm looking for may not be what the patient is happy with. So we're going to desire it, you know, we're going to make it to their needs. Often I have patients, when you're doing enough teeth and you have the freedom to do what you want, I have them bring in magazine pictures, close-ups. I want to see what really gets them. What's their excitement about? And then I just go ahead and make my biotemps and order it with those instructions. So test driving for me is huge. I guess one tip that I would talk to doctors about is when you're trying to evaluate if those aesthetic changes are where you want them to be, don't do it while your patient's numb. Mm-hmm. Right? You've just numbed the patient, you've worked on them maybe for 2 hours, 3 hours, however long that appointment is. And you stand up and you're trying to get them to smile and you can't tell. Right? So I always bring those patients back at a later appointment, usually in about 2 or 3 days. And I can tell probably 100% of the time, the minute they walk in the door and they smile, what I need to change. And they'll have a list sometimes of, you know, can you fix this, can you fix that? And we'll tweak the temporary. And then we go from there.
Right, so you're test driving and then you can make little changes as you go along, improvements to develop it further to their liking.
Right, and that's the beauty of biotemps. They're so versatile. I mean, you can get them back from the lab and sometimes they're just drop dead gorgeous, perfect. Other times there's just little variations, really small embrasure changes, maybe some facial contours that you really want to tweak that's unique to that patient.
And the changes that you make in the biotemps, how do you capture those changes and send it back to Glidewell for finishing?
So we're going to take a model when we're done. So that temporary is polished, cemented. We take a nice model of it. And we also take a whole host of photographs. Lateral views, retracted views, smile views, patient at rest. So we're giving the lab as much information as possible to make that outcome as predictable as possible.
So when the lab does its digital design of the final restoration, they can incorporate all those changes?
Absolutely, absolutely for us.
So Dr. Barrett, what are some of the clinical advantages you've found using biotemps versus a chairside temporary?
So clinically, it reduces chair time, right? Strength, unbelievable. So we don't have patients coming back with their temporaries broken, and then you have to sit there and remake it chairside, which takes time, obviously, inconvenience for the patient. Color stability, right? It's great. I can alter them, customize from the patient. The other great thing about biotemps, especially when you're working with young doctors, and it could be any doctors, but really that young, right out of dental school doctor who hasn't done much crown and bridge, biotemps are a great guide for them to hone their preparations.
Preparation skills.
Right?
Okay.
So if it doesn't draw, there's an
Right.
issue, right? The lab does such a nice job with them that you can really become a much better dentist by using that as a guide to your preparations. So constantly I get doctors that call me and say, hey, this biotemps, they don't fit. I don't understand what you're talking about. And I go and work with them chairside, and 100% of the time, it's the doctor's preparations that have to change. The temporary is spot on.
Wow.
So that's really a great benefit.
Now there's also there's a prep guide available from Biotemps. Do you use that?
I do, and that's a big help.
Okay.
So everything that comes with it is all a big help, but it's trying to get a new doctor to understand that their prep has to change. They're used to that, sometimes that prep that they've done for years and years, and now we've got a CAD/CAM design preparation that's really ideal,
Right.
and it makes the process much easier.
Excellent, excellent. You also mentioned marginal integrity was one of the benefits of the Biotemps. How did you mean that?
So when I reline my biotemp, and in my technique for doing it, I use acrylic to do it, I can really thin the margins so that they're ideal. And my goal is when I get the patient back to seat the restorations and I take that temporary off, there's no bleeding, the tissue's pink and it's healthy, and it allows me to bond in a restoration with ease.
Okay.
So biotemps are amazing because I can thin those margins really all the way down, knife edge, no bulk. And that's the true value of them. Now you don't have plaque that sticks to them, home care becomes easier, all of those things. And a lot of times when we're doing gingival recontouring with patients, we need to put temporaries in that are kind to the tissue.
Sure.
Right? So I encourage my doctors to learn how to do reline biotemps themselves. Not always rely on an assistant to do it,
Right.
because assistants come and go, but these are skills that stay with the doctor forever.
Right, right. And of course the gingival aesthetics are a key part of the final restoration, so you're enabling that as well.
Yeah, the only thing I really can control in my restorations, I mean, I can tweak the incisal edges and braziers, but the gingival health is really the only thing that's under my control. The rest of it, the lab follows what we've done. They do a great job on the aesthetics of it, but if the gingival health isn't there, then the case is a failure.
Dr. Barrett, as we've discussed, you mentor a lot of young dentists. What kind of tips can you offer dentists that are doing their first couple of Biotemps cases?
A couple things. One, you want to start with good alginates. You have to have good impressions to start from the beginning to send to the lab. And you have to give the lab some detailed instructions. So the nice part about the biotemps and the temporary that you're making, it's going to be detailed to whatever you want. Adding length, taking out rotation, all those instructions need to be clearly documented to the lab. Photographs should be taken of the case to provide to the lab. So another great tip for doctors is to remember that when you're doing biotemps, if you're doing single units, always ask for them to be splinted together. A mistake I made a couple of times was having them come back as individual crowns. Very difficult to reline them and have them all lined up the way they are in the model. So even if it's individual crowns, I always ask for them to be splinted together. The other great thing about the biotemps that I would encourage the doctors to do is to make sure that they bring the patients back and evaluate the aesthetics when the patient's not numb. I know we talked a little bit about it before, but I can't overemphasize the importance of that. Too many times we look at patients when they're numb and their lips hanging down,
Right.
and we try to tell them that, okay, it looks okay, when it doesn't. I don't think that doctors should be afraid to go ahead and take a burr and customize that temporary. Even though it's come back from the lab, go ahead and open an embrasure. Do what fits your eye for that patient. And then ultimately I want them to repolish them so that they have the shine and the luster that they came from the lab with,
Right.
before they cement them in place.
And you also mentioned that you want the young dentist to fit those biotemps himself rather than sharing that task with the auxiliaries.
I would love them to. I work chairside with doctors every day of my life. And I want them to pick up the temporaries and learn how to do these things. If I would have not waited later in my career to learn these things, I would have had a much happier career. It would have been much easier
Got
for
home
me.
earlier, right?
Yeah, you really don't want to be held hostage to your staff member, right? The doctor needs to jump in there sometimes and just take over the case. And I think new doctors are very intimidated by anterior aesthetics. So just knowing and following smile design principles and incorporating them into your temporaries is a huge learning curve for doctors. And the sooner that they can master that, the better off they're going to be in their career.
Well, Dr. Barrett, thanks so much for joining us today and
Thank
sharing
you.
some tremendous clinical tips about using biotemps.
It was a pleasure. I thank you. Glad to be
Thanks.
here.